Hello, my name's Marilyn. I'm 66 years old and generally in good health. When I first signed up to use the records, I didn't actually have major conditions which necessitated me going in and looking at them. I did, however, go in and look just so that I'd keep myself familiar with the whole process of accessing records online. One thing I did do was look up some test results, and as a result of looking them up and understanding them more, being able to research what they were all about a bit more, had a very constructive conversation with the doctor about them. And as a result of that conversation, as they were borderline, whereas he'd have continued prescribing medication, I now don't take that medication. A year ago, I shattered my wrist and found the records access extremely useful then. I could look at the x-rays online and I could also see what the consultants were saying about the damage that I'd done. I found this useful in that on reading the letter that he'd sent to the doctor, I noticed one or two concerns that he had, which meant that I could write those down, and when I went to see him and discuss the progress of the break, I could ask him specifically what those realignments meant. My grandson Harry is 4 years old and he has severe haemophilia. This is a really complex condition. My daughter also has access to her records, and she's found it invaluable in helping Harry to get the best treatment, to stay healthy and to understand his condition himself. Without records access, I think we'd have been floundering quite a lot. Everything is done through records access and online, so much so that the hospital are amazed how little they see Harry. Having access to my records, even though I'm in generally good health, when I have had these little blips like the broken arm, etc., it's helped me, it makes me feel as if I'm more in control. Nobody can pull the wool over my eyes medically, because if I don't know what the words mean on those bits of paper, I'm certainly going to research Dr. Google and the other things out there and make sure I fully understand what's going on with my body and what people are doing to it or are aiming to do to it. And it will only be with my informed consent. Informed consent is safe medicine, and I want safe medicine.